There's been a lot of talk this week about the politics of health care, the president's victory in getting the bill through the House, whether it will help Democrats in the 2018 midterms. But the real question is how the House Republican plan would affect you and your family. Would it mean better, more affordable health care coverage, or worse? Joining me now to debate that from Austin, Texas, GOP strategist Karl Rove. And from Boston, MIT professor Jonathan Gruber, one of the architects of Obamacare. Well, one of the big criticisms of the House plan is how it would treat older Americans who don't yet qualify for Medicare, and also how it would treat people with pre-existing conditions. Professor Gruber, what's the problem there?
Well, the problem is that for older Americans, their health insurance is very expensive. And under Obamacare, that is dealt with by limiting how much more they can be charged relative to younger people, and by having tax credits that limit the percent of income they have to pay for health insurance, as well as expanding Medicaid to lower-income adults. That all goes away under the House alternative. The Medicaid expansion goes away, so for the poorest elderly, they don't have access to health insurance. The tax credits become flat tax credits, not income-based, so the elderly have to pay much more for their health insurance. And so basically you have a system where it's just not as protective of those people as the existing law is.
Karl, let's talk about both aspects of this. Democrats are now saying the fact that there isn't as much protection of people just shy of Medicare, they're calling that the age tax, and the compromise that the House passed does this about pre-existing conditions. It provides states that set up high-risk pools with another $8 billion extra over 5 years to help people with pre-existing conditions. That's on top of $130 billion in the program to help states with other costs. But Democrats say, and you just heard a suggestion from Professor Gruber, Karl, that that's still not enough.
Well, let's first of all take the band, the 3-to-1 band that causes younger people under the Affordable Care Act to subsidize people, older people. It's expanded to 5-to-1. Now, why is that done? That is because older people have health care costs that on actuarial basis are roughly 4.8 times those of younger people. So what we've got now is a system that, if you want to call it a tax, right now we're taxing virtually everybody under the age of 50 by causing them to pay more for their premiums, to subsidize the coverage of people over the age of, say, 54 or 55, to reduce their premiums, despite the fact that that older group, on average, has higher incomes, higher wealth, and less child-rearing expenses than the people below that we're overtaxing. Before we had the Affordable Care Act, 42 states had set the bandwidth at 5-to-1. 3 of them had it at a lower level, 3-to-1 or 1.5-to-1. Okay, and the rest of them had no standard.
I don't want you to get into
the reason was
I got it, but we've got to and now talk about pre-existing conditions, because that, as you know, is really the hot button right now.
Well, look, the bottom line is there's a lot of trash being tossed about out there. There's no change in pre-existing conditions for the people who are in the Affordable Care Act and are in states that don't have a waiver. If a state asks for a waiver, it can say, if you haven't had continuous coverage, you haven't had any insurance coverage, or you let it lapse for more than 63 days, and you have a pre-existing condition, you get an insurance policy, but you can be charged up to 30% more than other people your age for 1 year as an incentive for you to stay under continuous coverage. And you're right, there's $8 billion there to pay for people who have extremely expensive illnesses.
This is a debate, so let me bring Professor Gruber in. Why isn't that enough, that protection for people with pre-existing conditions?
Look, the most important accomplishment of the Affordable Care Act was ending the ability of insurers to say you can't get insurance or you're charged multiple times because you have bad genes. That's a horrible feature of our system. Americans don't like it. Why would you possibly want to reintroduce this? And that's what the law does. It opens the option for states to reintroduce the ability to literally say, just because of the genes you're born with, you're going to pay more for health insurance. Many, many multiples more. Now, the law does include funds for the so-called high-risk pool. I call it a high-risk puddle. By all the estimates that are out there, these are trivial funds relative to what would be needed to actually pay for these.
Gentlemen, let me move on.
No.
Go ahead, but quickly, Karl.
Look, all right, first of all, it does not change pre-existing conditions for the vast majority of people. But if your state waives out, the only thing that they can do is charge you up to 30% more if you have elected not to have insurance coverage. And as to the amount, the last year that states had high-risk pools, 35 of them in 2011, they spent $1.6 billion out of state money on those high-risk pools. It should be 1.4.
All right, wait.
This provides $1.6 billion.
I've done this in a presidential debate, so I'm going to do it with you guys. I want to move on to another subject, and that is Medicaid, because more than half of the 20 million people who gained coverage under the Obamacare gained it through the expansion of Medicaid, which allows more people higher up over the poverty line to be covered. But the House bill cuts Medicaid by $880 billion over the next 10 years by ending that expansion and turning the program from an open-ended entitlement into a fixed block grant to states. Karl, why is that good?
Because it focuses Medicaid on who it was supposed to be focused on, which are the vulnerable, the disabled, and the young. And it says to states you can put in place work requirements so that people who are able-bodied and capable of going out and getting a job and getting coverage on their own can do so by removing the disincentive to just simply stay on the roll. And yeah, it cuts the Medicaid over the long haul, but it increases the amount of money that is spent on the blind and disabled, children, and those with ailments, and those that have children and are single parents. So by all means, we ought to focus this program more and more on the vulnerable in our society and not simply people based on their income with a disincentive to work.
Let me bring Professor Gruber in. I'd like you to respond to that, and also to the larger issue of entitlement reform. We've been talking about that for years and years. Is this entitlement reform?
So look, Mr. Rove is absolutely wrong in his comments on that. Medicaid, let's remember what Medicaid does. 2/3 of the money is spent on our nation's elderly and disabled. You can't cut that program by 25% without massively hurting the elderly and disabled in this nation. It's just simply mathematically impossible. So you are talking about a program which takes care of our most vulnerable citizens and cutting it by 25%. And why? Once again, let's talk about what does this do? This law does nothing to fix our U.S. healthcare system. All it does is just massively cut funds to have a large tax break. So if we want to talk entitlement reform, that's a totally legitimate discussion to have. But let's have that discussion in the context of reforming entitlements in a way which doesn't harm our nation's citizens, not cutting a program for the vulnerable by 25%.
I want to get into one last subject with the two of you, because this effort at reform isn't happening in a vacuum. The effort is to replace Obamacare, as Reince Priebus said, well, this is a choice between Obamacare and something different. And I think everybody agrees Obamacare has serious problems. Here's President Trump on Obamacare this week after passage of the House bill.
I predicted it a long time ago. I said it's failing. And now it's obvious that it's failing. It's dead. It's essentially dead. If we don't pay lots of ransom money over to the insurance companies, it would die immediately.
And here are some stats. Premiums under Obamacare went up an average of 24% across the country this year. The average number of insurers in each marketplace has dropped from 5.9 in 2015 to 3.9 now. Professor Gruber, in Iowa, there is now only one insurance company left in all but 5 counties in Iowa, and they just announced, Medica, that they're thinking of dropping out, which means there'd be no insurance companies for the marketplace in all but 5 counties in Iowa.
Look, and whose fault is this? Before President Trump was elected, there were no counties in America that did not have an insurer. Since President Trump's been elected and massively...
Wait. You're going to blame the problems with Obamacare on President Trump?
We had a situation under Obamacare where there was a one-time premium increase last year that made up for the fact that insurers massively underpriced in the first 2 years. The problem was fixed. Insurers' profits were trending positively. Insurers were saying positive things about their ability to stay in the exchanges and succeed. Then you have a president who comes in, undercuts open enrollment, doesn't honor the obligations this law makes to insurers.
All right.
And as a result, premiums are going up and insurers are exiting. You can look at the quotes from insurers themselves.
We're running out of time, and I'm interrupting both of you equally. Karl, your thoughts about that?
Look, last week, Dr. Gruber wrote a
here's the
column in which
whiteboard.
he blamed it all on the insurers because but they guessed wrong. Really, actually, the government told them to consider that they would get a lot more healthier, younger people than they actually got in any single year that this program's been in effect. He said Trump stopped the ads. Trump stopped the ads on the 26th of January, and the end of the enrollment period was the 31st. Really, the problems of Obamacare are going to be solved by 4 days worth of TV ads? Really? He also said the executive order said not to enforce the individual mandate, and that caused problems, disruption in the force. Well, President Obama delayed the individual mandate for 2 years and the employer mandate for a year. And finally, he said, he talked about the cost-sharing payments, and that caused distress among the insurance companies. Well, the insurance companies are getting the cost-sharing payments despite the fact that last year a federal judge declared them illegal. President Trump said, I'll continue to pay them until the issue is resolved. Last October, Dr. Gruber said the program is working exactly as we designed it. Now, it was designed, as he said earlier, with the stupidity of the American people built into their calculations of how to sell it. But it is a broken system, and it's going to go under. And
I got to give Dr. Gruber the last word here. 30 seconds, sir.
Okay, so basically you have a system which was not working perfectly, but it was a system which was very fixable. The question is,
can you respond to what Karl just said?
Well,
working as designed. It is working as designed. There is no sense in which it needs to be fixed, Mr. Gruber said. The law is working as designed.
The law could absolutely be improved. But the question is, instead of improving it, why do you take steps to undercut it and then cause 24 million people to lose health insurance and seniors?
No, that's not true.
Pay five times as much for insurance.
It is not true. That
That's
says
absolutely true.
The CBO. No, it isn't. The CBO said those were people who did not have insurance. That is to say, they would not buy insurance because they were no longer
24 million more Americans are insured.
That's only 10 million people are covered in the exchanges. How can you lose 24 million people if 10 million people have bought insurance?
And we will continue this debate, but we want to focus on how it will affect you, not how it will affect the politicians as the bill makes its way through the Senate.